If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. As you know, this program was created to assist you in taking care of yourself. Each week we have two experts to answer your questions. And today we have a very special show. We're out here in Park Slope, Brooklyn, at the Church of the Virgin Mary. And we have a live studio audience. This is history for Ask the Doctor. We've never had a live show on the air before, so I can feel the tingling in the room, actually. You can just feel that excitement. And it's a very special church, and we're going to actually show you some of the interior a little bit later on. But what I'd first like to do is ask Father Antoine to give us a prayer for everyone's health and for a good show. Father?
Blessed is our God at all times, now and always, and forever and ever. Amen. Thank you, our Lord, for this show, for the doctors. We ask you to bless them, bless their hands and their commitment and their service spirit. We ask you to bless all present here and net the channel, and we offer our prayers for all the sick and the suffering, so you may heal them and soften their pains. In the name of the Father, and the Son, and the Holy Spirit. Amen.
Thank you very much. Thank you. Give a hand for the... Okay. And before we get to meet the doctors, I want to give a special mention to Dr. Bakash, who's always been such a strong supporter of the show. He's been on the most, I think, of any guest, and also in helping to arrange this, and in the health fairs that he does throughout the year. So thank you. Now, what we usually do is start off with In the News, and what we look for is stimulating or interesting stories that have been in the news in the past week. And obesity continues to be front and center in the news stories. About 2/3 of adults are either overweight or obese, and 1/3 of children. So this is a real problem because you think of diabetes, heart disease, all these problems related to obesity. And I thought since we had a crowd down here tonight, I wanted to get your sense of what you felt about the new law that they're going to limit the size of soft drinks. Because actually, 2 days ago, 2 new studies came out that showed that kids who were restricted in their sugary intake of soda or fruit juice actually didn't gain as much weight as the counterparts who did. So the question is it worth giving up the freedom where somebody's going to tell you what you can or cannot do for this? I'm curious, anybody out there have any thoughts on this? Anybody on the panel have any thoughts on this?
I think it's great.
So Kirsten, I have to introduce our assistant here. She thinks it's great, the law. Anybody feel put off by it? What do you think? Sit up, don't be shy. What's your name?
My name is Daniel Lahaj.
David Lahaj has opinion here.
Daniel Lahaj.
Oh, Daniel also has an opinion.
No, I'm against the mayor regulating something like that. I mean, there are states decriminalizing marijuana use, and here he's making soda of a certain size illegal. I think it's a revenue boosting tactic to put fines on businesses, and the government has no business in telling a business how much they can service for soda.
So you're against it?
Yeah, I'm against it.
Does anybody else have a thought on this? Yes, I see way in the back there, way back. You could stand up, please. Hey, what's your opinion, sir? Who are you, please?
My name is Leonard Robertson, and I don't believe, as my fellow parishioner believes, that the mayor or any governmental agency should give us or take away our freedoms for these different issues. What the public needs is more information for families to make the right choices. It's not for the government to restrict or regulate what we do, but to provide the right information so we can make healthy choices for ourselves.
Excellent. So that's I like that. I like that. We'll take one more word. Back, yes.
Stand up. What's your name?
Christine Kawar. I think we need to teach the consumers self-control better than taking away the freedom of choice. Once they learn what's good and what's not good for them, they will learn how to make their choices.
Okay, that's excellent. If only I could read lips. But no, it's a little bit But you definitely will be able to see it on the show. You'll be able to see that answer when it airs. But anyway, I think that I love the answer back there about educating people so they can make the right choices, but not to restrict their choices. We have free will as human beings here. So, what do you say, Barbara?
I said that you can always buy two. You can still drink 32 ounces of soda, you just have to buy 2 of them. So no one is restricting your ability to drink as much as you want. You just can't buy them in a single serving size.
So, thank you. What do you think? I see we have a very young person here. What do you think about this soda law? Do you drink big sodas? No. She shook her head no. So, no is the answer, Kirsten? Okay. I'm going to move on to the next topic, psychopath. Psychopath and sense of smell. Very interesting. They found that people who were sociopaths didn't relate well with society. They couldn't smell like an orange or other flavors. They could not separate them out. And actually they found other diseases, Parkinson's disease, Alzheimer's disease, and schizophrenia had the same problem. So we're not sure what is the significance, but there seems to be a link between the two, and it may be an interesting way to make a diagnosis. Very hard to diagnose, for example, Alzheimer's disease. And having this difference in sense of smell may help. So it's something to think, to be aware of that's in the pipeline. Then the other story was about chocolate. Everybody, I think, most people love chocolate, right? Yeah. So what they're talking about is they're saying that the same part of the brain that gets stimulated with opium is the part that the chocolate stimulates, and it makes chemicals get secreted in the brain that make you feel good. So people like that a lot. Now I brought a little prop here, a little Godiva chocolate. We have a low budget, otherwise I would have bought the big size. But anyway, what we can do here with this is I have a quick trivia question, and whoever raised the hand first with the answer is going to get this Godiva chocolate bar, dark chocolate. Okay, here we go. Which president was born in New York?
Oh, I saw a hand right back. He says Roosevelt right back there.
Can you be more specific? Theodore Roosevelt is absolutely correct. There you go.
Nice job.
Excellent.
You can share that with me
Look at
though
that.
later. Okay, all right.
Actually, for a bonus, does anybody know how he came to be the president? Who did he replace, under what circumstances? Somebody
I see a
died in
hand.
office, and he took over.
I see a hand back there. All right.
Coolidge it wasn't, but you're close.
McKinley was assassinated?
Was it McKinley?
McKinley is correct. Yes,
Nice
excellent.
job.
Now, he's going to share that with you. Okay. So we're going to come back. We can take a little break now because we got to do some housekeeping and pay the bills. And then we're going to come back and meet Dr. Bakash again, Dr. Goldberger, and Dr. Gatton. So don't go away. Okay, and welcome back to Ask the Doctor, where our guests are Dr. Bakash, Dr. Goldberg, and Dr. Gatton. And let's meet the doctors. Dr. Bakash, hi, welcome to the show.
Hi, thanks, Steve.
Tell us a little bit about what you're a geriatrician as well
Yes.
as an internist.
Right, I'm a geriatrician. Geriatric medicine is the study of the treatment of older people, so mainly patients over 60 years old. So we call them the young old, and then the people over 75 are the regular old, and the people over 85 are the old old. So basically, similar to what a pediatrician is to children, I am to older adults. And I have special training in geriatric medicine, so there are problems that are unique to older people that are not found in middle-aged people or younger people that I would handle.
Thank you. And he's also the president of the Medical Society of the hospital, New York Methodist Hospital, which is a prestigious position, a very demanding position, and he's been asked to stay on an additional time from the original.
Right, this is the end of my
term.
3rd year, so I have, unless I pull a Bloomberg changing the statute of the term limits, I basically am at the end of my limit of term.
Thank you for everything, though. We appreciate
My
it.
pleasure. My pleasure.
And now, pleasure. Who's had a root canal done here? Anybody? Yeah. It's not the most fun thing in the world, right? Right. I'm telling you, I got a guy here that when you come in to have a root canal, you'll be walking out smiling. You don't even know you had it done. Dr. Goldberger, who's amazing endodontist.
Yes.
And tell us a little bit about yourself.
I'm Dr. Robert Goldberger. I am an endodontist, which is a dentist that is a specialist in root canal therapy. I have a practice in Brooklyn Heights, and I teach at Methodist Hospital, and I direct the endodontic residency program at Lutheran Medical Center, also here in Brooklyn.
Thank you. And Dr. Barbara Gatton is to my left. She's an emergency room specialist. So how many have used the emergency room? Right, so we have a few people have come. What I want her to talk about a little later on is when should you go to the emergency room and when are you wasting your time? So let's hear, tell us a little bit about yourself. You're training for a marathon.
Yes, I'm sorry that I've seen some of you in the ER. I hope that please come in when you need to. I'm training for the marathon this year, the New York City one, so root for me, cheer when we're out there. Do you want me to talk about that now or later?
We can get into that a little later. What was the most interesting case you saw in the emergency department last week?
Well, we had a lot of interesting cases in the emergency department this week. But one of the scary problems that people have sometimes is there can be a tear in the big blood vessel going from the heart. And we had someone who had that. That's called an aortic dissection. And someone came in right away and got treated promptly by our vascular surgeons and our emergency medicine team. So if you have chest pain and shortness of breath and it's going to the back, you need to come straight to the emergency room. But that was very dramatic, but luckily the patient did very well because they came in right away.
So this is the lineup for tonight, and then what we're going to be doing now is taking your questions from the audience, any medical questions that you might have, or just, you know, it doesn't even have to be your problem, it could be a friend's problem, something like that. We usually get a lot of that. So let's see, I have to introduce Kirsten, who's our on-air assistant, who's new to the show this year, and she's going around to give her a big round of applause.
Hi, guys.
Very talented person, right?
Thank you. And ditto.
Tell us a little bit about yourself, Kirsten.
Okay, well, my name's Kirsten, and I'm just really grateful to be a part of the show. And we're really thankful for you guys watching the show, too, because if it weren't for you, there'd be no show. So thanks for coming today, guys. Thank you so much. We appreciate it.
Yeah, thank you very much. I want to recognize Joe Stiles, who's sitting in the first row here, who's a fixture in the city and as far as hospitals, and there's so much that he's accomplished. He's on many different Catholic executive boards and so on. So, Joe, thanks for being here. Joe.
I watch this program every week. It makes a great images. Put on your channel 30 net and watch the program. You get a lot of information. And there's only one way: preventive medicine. We need the prayers, we need the physician, and we need the pharmacy. You do those three things, you live a long life. God bless.
Good job, Joe. Thank you. Thank you.
Good job, round of applause. Thanks, Joe. Okay, so we've met the doctors. Everything is pretty much straight. We're going to take a break. Before we go to break, though, I have another question. And this prize is going to be for one of the shirts that has the tablet on the back. Does anybody read the tablet? Yeah. Good. And on the front it says NET. So this is I think it's a valuable gift. It should be good because it's cold in here. So you put this on and you're all set. All right. The question is, go back to 1898 and look at the top 10 lists for boys' first names. Now go to 2005 and look at the top 10 list for boys' first names. On both lists will be one name that is the same. What's the same name that was in 1898 as was the 2005? Kirsten, you want to go down there?
Yes, she really wants to answer right over here. Okay, stand up and tell us your name.
My name is Meral Saikali.
Where are you from?
I'm from Lebanon.
Oh, very nice.
I think it's Joseph.
Thinks it's Joseph. Anybody thoughts on? I mean, do I have a drum roll here? Whoa! I can't believe she got the answer. It's Joseph. I don't know how you killed the whole. I thought it'd be. Yeah.
Nice work.
How did you know that? Here, Kirsten.
Oh, awesome.
That's amazing. I would have guessed. We had George down here and other. Michael, George. Amazing, amazing. So anyway, with that, I can hear the crowd still muttering over that because it's like bingo. You have it and then someone beats you to it with one to go. So, all right. So we'll take a short break, and when we come back, we're definitely going to be answering your questions. So start thinking about them, writing them down, and don't go too far. We'll be right back.
I am Father Antoine Rizek, the pastor of the Church of the Virgin Mary. We are located in Park Slope, Brooklyn. We are a Byzantine church. We belong to the Melkite Catholic Church of Byzantine tradition and spirituality. Now you can see behind me the altar. and the narthex, and especially the iconostasis that separated the altar from the narthex of the church. We have a lot of Byzantine icons painted or mounted on the walls, and iconostasis and everywhere, and mosaics too. It's very colorful church, and it's like to celebrate the mysteries with joyful spirit, to help people to enjoy the celebration of the Divine Liturgy and to be in joyful way. I would like to thank Net TV for coming and visiting our church. I hope you enjoy the beautiful icons and the colorful mosaics. And you are welcome to visit our church anytime you would like.
And welcome back to Ask the Doctor, where our topics are geriatric medicine, endodontists, and emergency medicine. And we're ready. We have a very special show tonight, originating from the Virgin Mary Church here in Park Slope. First question of the night. Who's going to have that honor? Yes, Miss. Please stand up and wait till Kirsten gets out there.
So
My
tell
name
us what
is
your name
Teresa
is.
Hegel.
Where are you from?
I'm from Brooklyn, New York. Lived here. Parents from Lebanon. I wanted to know about the West Nile virus. Has there been any outbreaks here in Brooklyn or locally, even Park Slope? Has there been any outbreaks?
I'm going to ask Dr. Backash to start and then go to Dr. Gatton to finish up.
Sure. I haven't seen any in my practice at all. There have been some suspicion of it, and there's a simple blood test that can be done to make the diagnosis. If someone presents with a flu-like illness that you suspect a West Nile outbreak or virus from, but I haven't really seen any cases, so I don't think there's been much activity. Dr. Gatton?
Similarly, the Department of Health sends us a weekly update, and so there haven't been any cases in Brooklyn that we're aware of yet. Though, that being said, if it was mild, someone may not suspect it, but if it's mild, you'll get over it anyway. It's just like a regular cold. But of the serious cases, none have been reported in Brooklyn yet.
And remember one thing you want to avoid. You want to avoid perfumes and eating spicy foods because the mosquitoes are attracted to that flavor. And the other thing is if you're with the child and the child gets bitten, it tends to scratch it and infect it. If you put roll-on deodorant on the scratch, it stops the itching right away. Try it. Yeah, roll-on deodorant. It's amazing. It works. It's roll-on. So you want to try that and see. Who's got the next question here? Yes, can you stand up, please?
Okay. So what's your name?
Hi, my name is Lorraine Yabrudi. I'm a parish member here, and I live in Brooklyn, New York. My question has to do with obesity. On the internet, I was watching a show, and they were talking about the green coffee bean, and they said that before it's roasted, it's very effective. So they've put it into a tablet form, and it's supposed to take care of body fat and reduce your appetite. Is that true?
Okay. Okay. Dr. Backash, you want to grab it? Okay, so the question is, how many people believe you can lose weight without doing exercise or eating less? No, I don't think so. So the thing is, there's always very good advertising that makes you feel. There was another pill that also came out earlier this year that was supposedly sped up your metabolism. You didn't have to exercise. Again, that didn't work either. And there are other benefits aside from just losing weight from the exercising. For mental health, it improves your mental health ability, keeps you sharp. So the point is, you get nothing for nothing in this world. Theoretically, it might work, but number one, there's no long-term studies, and I doubt it highly. So the best thing to do is to eat less. Eat less. Yes, sir.
I just want to add to this. I'm Michael Yabrudi. We saw it on the Dr. Oz show. That's the reason it was brought up.
Now, yes, I see we have to keep Kirsten giving her exercise.
Okay, we're going to come over here. Here you go.
Hello, my name is Alia Fahmy. I would like to ask a question about colonoscopy and when it's time for a woman to start doing the test and how long, like for how long a woman should, keep up with it.
Colonoscopy, Doctor?
Yeah, colonoscopy, as you know, is a test where the doctor, the specialist, usually a gastroenterologist, looks inside the colon. And the test is used to diagnose cancer of the colon or to see if you have polyps. And the screening test should be done in everybody, male or female, over the age of 50. If there's family history, you should start at least 10 years before the diagnosis of the relative who had the cancer. So if somebody in the family had cancer of the colon at 50, you should start at 40. If there's very high family history, a strong family history, you should have it done every 5 years. If somebody does a colonoscopy and they find polyps, then you should have it repeated every 3 to 5 years because it's likely that you'll have more polyps. So the answer is there's no sex difference whether it's male or female. Everybody should have a colonoscopy at age 50.
Good. Yes, I wonder, who's the longest reigning parishioner here? Who's been going here the most to this particular, any in the room? Yes, how many years? That's 61 years. 60 years. Anybody longer than 60 years? Wow, give it. Excellent, excellent. Yeah.
It's not a question that I have to ask. I just want to say, say thank you to Dr. Bakash. Just about a week or so ago, I called Dr. Bakash, not feeling well, and he said to me, you know, Larice, I think you should go to the emergency room. And I have to say, while I was there, everybody was great. To me, the Methodist Hospital is my home away from home. I've had surgery and everything done there, but I find it such a very friendly place to be. And of course, having Dr. Bakash is the icing on my cake.
Excellent.
Thank you very much.
Happy to hear it.
I would rather have my home away from home in the Hamptons, but it's not bad. Okay. Anyway, I want to tell you a little bit about Dr. Goldberger, endodontist. He does the root canal, but we have a question for him from a listener at home. The listener wants to know the difference between an implant and getting a root canal, and which would you recommend?
Of course I recommend the root canal because you're saving your natural tooth. And an implant is placed when your natural tooth can't be saved, and they have to extract that tooth, and then it's like a metal screw that sort of gets placed into the bone and integrates with the bone, and then they make a crown on top of that. But it's not your natural tooth, so of course if you can save your own tooth, you do. It's pretty simple.
Wait, there's a question?
But you can't always save it. So.
Can you stand up, please? You have a question?
My name is Jacqueline Lotfi, and I'm from Brooklyn, and I belong to Virgin Mary Church. My doctor, Dr. Bakash, is a wonderful doctor. I have a question about shingle. It's, they say whoever had measles, it's inside of them is the shingle. And now what I understand, they have a shot. Is that shot really work?
Well, if you've had exposure actually to chickenpox, you have a likelihood as you get older of getting shingles. Shingles is caused by a similar virus, herpes zoster, which is a virus that causes damage to nerves, usually on one side of the body, most of the time on the trunk, but it can occur on the face or on the leg or pretty much anywhere. The shot that's available is made by Merck. It's called Zostavax, which is you get one shot. It's just like a flu shot. You get it in the arm, and it's about 60 to 70% effective, which is pretty good when it comes to vaccines. You know, vaccines you may think are 100% effective, but they're actually not. So that's pretty good for a vaccine. The difficulty with this vaccine is that it's made in a way that it has to be stored under certain circumstances. It has to be frozen. And if it isn't frozen, it loses its power. So most doctors don't have the ability to keep the vaccine frozen to the degree that it needs to be. So it has to be taken from the pharmacy and given to the patient, you know, right away. They usually transport it in a freezer pack, or, you know, certain pharmacies around the area are actually offering what's called zoster vaccine clinics, where you just go there, give them your insurance card and the prescription, they give you the shot right there at the pharmacy. So I think if you're over 65, yes, I think it's a very good idea. It cannot hurt you. It's very safe. They just give you a small shot in the arm, but The problem is that a lot of insurance companies don't reimburse for the vaccine, and the vaccine costs about $200.
Thank you. Thank you.
You're welcome.
Dr. Garner, I have a question back here. Yes. It's from Raymond. Do you want to stand up?
All right.
All right.
Say hello to the doc.
Hi, Raymond. Can you stand?
Hello,
Thank
doctor.
you.
My name is Raymond from Brooklyn, New York, and I have a question. What generally causes cramps in the body? A chemical imbalance or what?
Interesting. So, Dr. Gatton, when you see a patient come in, he's got muscle cramps and so on, what do you think of?
There are many things that cause cramps, and some of it depends on what else you've been doing. We certainly worry about electrolyte abnormalities. You know, if you came to the ER, we would, want to know what you'd been doing recently, if you'd increased your exercise, but also what you'd been eating. Sometimes it's some deficiencies in some of the minerals you eat and electrolytes like potassium and magnesium. But we would certainly do some blood tests to look to make sure it wasn't something more serious as well.
Very nice. Do you have another?
Yeah, sure. What can also, was a very common cause of cramps is dehydration. So if you don't drink enough fluids, it's not uncommon to get cramps in your legs. The use of diuretics, which are water pills, which are generally prescribed for hypertension, sometimes cause cramps. And that's sometimes with the shifts of electrolytes like magnesium, potassium. That's why bananas and things like that are often advised. If you're getting them often, your electrolytes need to be checked by your doctor, and it's very simple to do.
Thank you. I have a question for Dr. Goldberger. How do you know when the tooth is dying? I mean, you hear things. Is it when it's cold, when it's hot? When do you know about that?
There are a lot of signs and symptoms when a tooth is dying. Cold is one. Pain is a symptom. Obviously, pain to cold, pain to heat, pain to pressure, biting pressure. But many times, the pulp tissue, what most people call the nerve in the tooth, it dies very quietly. You never know it, and it becomes infected. The resulting infection is then in the bone, and you wake up one morning swollen out to here, and you never had a moment's pain. So you don't always get a warning sign.
Oh, that's the worst when it happens on vacation. All of a sudden you feel that tooth begin to ache.
It always happens on vacation.
Kirsten, we got questions here.
Yeah, we do. We have a question right over here from Angela. Here you go. Tell us where you're from.
Hi, I'm Angela from Queens, New York. I have a question for Dr. Goldberger. How do you deal with the Alzheimer population, maybe in dentistry, as a general problem, since they have cognitive issues and it's difficult for them to cooperate?
That's an excellent question, and that is a difficult problem. Personally, I haven't seen that many patients suffering from Alzheimer's, but the few that I have are usually brought in with some sort of an assistant, an attendant, and you just try to ascertain the best you can. I mean, there's certain tests that we can do. We can see certain things with x-rays. We can do certain tests in the clinic, but you can't always get a reliable history from the patient, so you're at a disadvantage to diagnose certain problems. Certain problems are very obvious and evident, and other problems aren't. It's a great disadvantage.
Tough one, tough one.
It's a tough one.
But quick trivia question in here. And again, another shirt. This is a large, made in Honduras, so watch out for this. Okay. The question is, what's special about the Church of the Virgin Mary walls? What's special about the Church of the Virgin Mary walls? Okay, Kirsten?
What's the answer?
The iconography.
That's one thing that's special. What about the writing? What's special about the writing on the walls? Excuse me? No writing on the walls.
It's in Greek.
Absolutely right. So we had two answers about the iconography and about no writing on the walls. So give this out and let them fight over it. No. No, we got to give two. Here, give one to each, please.
Okay.
Thank you. That's a good one because this is unusual. We're going to actually be walking through the interior of the church with Father Antoine. Towards the end of the show, you're going to see this. So it's a beautiful church. Okay, what we're going to do now is we only have 30 minutes left in the show, so we're going to take a quick break. And when we come back, we're going to be asking more questions of Dr. Bakash, Dr. Goldberger, and Dr. Gatton. Have a couple building up for you. So we'll be right back. Don't go away. Okay, and welcome back to Ask the Doctor, where our topics tonight are geriatric medicine and internal medicine, endodontics, and emergency medicine. And let's get right to the busy questions. We actually have one that came in on the other side of the commercial. Dr. Gatton, tell us a little bit about how you know you're having a heart attack versus indigestion, right? I'm sure a lot of times you're sitting there, you just ate a big meal, you feel little twinges in the chest. Is this a heart attack or is this everyday reflux? So what do you think?
That's actually a very tough question because they feel very similarly. We have people coming in saying, you know, my indigestion usually I take care of with some Tums and now it's not going away and it is a heart attack. Some things that sometimes help, but not always, are, you know, if you have worse pain when you're exercising or when you're walking and it gets better when you stop, that sounds more like heart. If it's worse right after you eat, but then goes away pretty quickly, that's more with stomach, but none of that is absolute. If you're having chest pain and you're worried, you need to come see me in the emergency department. Always better to be safe than sorry, and let us decide it's your stomach and not your heart.
Yeah. And while I have you here, Dr. Gatton was telling me about some of the things she thinks were key.
Yeah,
to being a good doctor.
There were the three most important things I learned in medical school. I already knew before I got there, but now I have just much more graphic examples of why. And it's wash your hands, wear your seatbelt, and don't smoke. You know, washing your hands will decrease transmission of diseases. Don't smoking leads to far more than lung cancer and emphysema, heart disease, stroke. And seatbelts save lives, just common cause of death in the young. So.
Thank you. Kirsten, we have any questions?
We do. We have Raymond right here with a question. Here you go, Raymond. Do you want to stand up?
Stand up, please.
Perfect.
Hi, my name is Richard Nasser.
Richard. Sorry, it's Richard.
Richard.
Was it ever Raymond? It was never Raymond. No. Okay.
What is
okay, I'm sorry to interrupt.
I said your name wrong.
No problem.
Richard Nasser.
Nasser, yeah. It's for the Dr. Dentist. I went through a total knee replacement. And they told me, whenever you go to a dentist, alert him about your knee replacement. What's the relation between my teeth and my knee replacement?
Excellent.
Okay, Raymond, that's a very good question. When you have dental work done that involves bleeding, you get what's called a bacteremia. Your mouth is probably the dirtiest part of your body in terms of bacteria. The bacteria from your mouth, from your saliva, goes into the bloodstream, travels through the bloodstream, goes all over your body. When you're a healthy individual, it's not a problem. When you have a hip replacement or a knee replacement, any prosthetic joint or a heart valve replacement, that bacteria can enlarge on that replacement, on the prosthesis. So the idea is to take the antibiotic an hour before your treatment, and it keeps the blood clean. So when the bacteria goes through the bloodstream, it's pretty much eliminated immediately. They changed that regimen. They used to say you do it forever. Then they changed the guidelines to only do it for 2 years. And now they've gone back to do it forever. So anytime you're going to have dental work done that's going to involve bleeding, you should always pre-medicate with your antibiotic. It's very important.
Thank you. Thank you.
We have two questions right here in the front. So first, what's your name? Where are you from?
My name's Joyce Andrea, and
Nice. I'm glad. Stand up.
there you go. My question is, when you drink coffee, does it affect your brain?
Good one. Good one. Does coffee affect your brain? Do you drink coffee, or your mom drinks coffee? Okay. Let's see what Dr. Backish thinks.
Sure, yeah. Coffee does affect your brain, and it makes you more alert. Basically, coffee has a substance in it. One of the many substances is a chemical called caffeine. And caffeine stimulates the sympathetic nervous system. So it stimulates the production of adrenaline, which is a hormone that is one of the neuromediators which these nerve cells communicate with each other. So you increase the amount of adrenaline in your body, so it actually increases your heart rate. It actually makes you more alert. There's a gland in your body on top of your kidneys called the adrenal glands, and they also produce adrenaline. And what happens is it stimulates the production of that, which makes you more alert. It's part of a fight or flight mechanism. So if you're in danger, your body automatically secretes more adrenaline to give you more alertness and to tell you that you're in danger, and sends the blood to your heart and to your legs so that you can run away or that you could fight. So caffeine is one of those drugs that just increases your alertness. It has an effect on your blood. The problem is that if used for a prolonged period of time, eventually your glands can't keep up with the production of adrenaline, so eventually you crash. So, but if you only have a few cups a day, it's not going to bother you. But
Can I answer your question? Are you the youngest person here today? Anybody thinks that they're younger?
I don't think so.
'Cause I want to give her
I think she should
a shirt. She's got to get a
shirt
shirt for having the guts to ask a question.
Good job. There you go.
You know, when Kirsten was your age, she was on David Letterman. Tell about.
Oh, Dr. Garner. Yes, I was a kid inventor on the Letterman show when I was 9 years old. Thank you. And I invented the diaper changing gas mask. It's very embarrassing. Thank you. So what's your name and where are you from?
My name is Mirmaraj Hakuliato. I'm from New York, originally from Syria. Okay, I need to ask the dentist. Sorry, I forgot the name. But Dr. Berger.
All of a sudden, these young kids are coming out of nowhere. They saw the shirt, and now I'm getting 3 kids that are 2 years old.
Okay. I need to ask about the root canal. We really don't have that much education about the dentistry. I need to ask about the root canal. How long does it last? And how often we need to replace it? And about the gum disease, when the earliest start, and when it start, how we take care of that?
Thank you.
Okay, good questions. So as far as the root canal is concerned, if it's done properly, and then the tooth is restored properly, it should last forever. It's not like it wears out after a certain number of years. A filling or a crown, that has a lifespan of 10 years or something like that, 15 years maybe. But a root canal, if it's done properly, and then as important, after the root canal, the tooth has to be restored properly. Usually it's a filling or a crown. In the back teeth, it'll be a crown. Front teeth, maybe just a filling. But if it's restored immediately after, it should last, if it's done properly, it should last forever. And as far as the question about gum disease,
When the earliest age, when
there's juvenile periodontal
The question was,
disease.
when is the earliest age, and how would you take care of it for gum disease? Earliest age and how you take care of it.
Proper oral hygiene at home, and for a child or for anybody, and proper checkups. Having a dentist take the proper X-rays and do the examination on a regular basis. And catching it at an early stage. Gum disease is a hard thing to control. Root canal is an easy thing, believe it or not. Patient needs root canal, you do it, and then they're done. But gum disease is a chronic problem that you sort of tend to fight over years and years and years. So you just need to maintain proper hygiene at home, flossing, brushing, and exams. You can't just think you're going to deal with that by yourself at home. Some people need to go for cleanings from the dentist every 3 months. Other people go every 6 months, otherwise once a year. But if you do have gum disease, you're probably at your dentist or your periodontist, which is a gum specialist. Every 3 months would be pretty normal.
Excellent. Thank you for the questions.
All
Kirsten?
right, so we have a question from Gabby right here.
Hi, Gabby.
Where are you from?
Hi, doctors. I'm from Indiana. My question is that I've gotten in the habit of taking a 5-hour energy shot drink almost every morning to help give me extra energy, and I was just wondering what the long-term effects of that could be.
The 5-hour energy drink.
Thank you.
Which I happen to know a little bit about that drink. With vitamins, it's got vitamins which aren't going to do much for you, and it may have a little caffeine in it. It really is not a good way to get energy, because you think you're giving your body something healthy because they put in vitamins, but you're not. You're basically better off eating a regular meal and having a couple of cups of coffee with it. than eating this little, the 5-hour energy, which is marketed very well. You know, the way these things are marketed, it's amazing because you think it's going to help you, but it's basically not. There's nothing more than taking a one-a-day vitamin and a cup of coffee.
I would like to add to that you know, it doesn't have as much fluid, and part of the thing about if you get coffee in tea or caffeine in tea or coffee, you're getting a lot of liquid with it as well, and caffeine is dehydrating. So if you're going to do 5-hour energy, which I agree with Dr. Gardner isn't really a wise move, but you do want to make sure you drink lots of water with it, because it doesn't have the water that other forms of caffeine and energy do.
Bobby, just to answer, we're talking about fluid and dehydration, becoming dehydrated. Just tell us a little bit about I think the most painful ailment known to man or woman, other than pregnancy, is said to be kidney stones. Just talking about dehydration, tell us a little bit about kidney stones, Bob, and then we'll ask Dr. Backash to finish it up.
Kidney stones, once you get them, you have a 90% chance of getting them again if you don't increase your water intake. So it's 8 to 10 glasses of water a day. And when we say water, it can be some orange juice or apple juice, but you don't want to do 8 to 10 glasses of that because that's 2,000 calories. But a little juice, a little water, anything that's not caffeinated, or alcoholic, those two things dehydrate you too. But you want to increase your fluid. 8 to 10 glasses of fluid a day will help you prevent kidney stones, as well as just generally be healthier.
Thank you.
Sure. You know, the most common kidney stone is a calcium kidney stone. It's calcium oxalate. Caffeine, some of it gets metabolized into xanthine, and there are some stones that can be xanthine related. But basically, this is a disease you really don't want to get. Most of the time it's hereditary. Sometimes it's not. It can be due to gout. People who have gout secrete, instead of calcium, they secrete what's called uric acid. And that's found in certain kinds of organ meats and, purines that call like liver, things like that, have that. And that can give you, sediment of these crystals that can form in the kidney and in your joints. And it can cause actually kidney failure over time. So it can be severely painful. That's just a disease where you will automatically know what to do because you'll be in so much pain. You will go see Dr. Gatton in the emergency room.
I'm just curious, how many people have had kidney stones out there? Yeah, so we have a lot of them. The question I have now, Dr. Backash brought in this demo model here. You see this thing? Anybody know what this is?
Oh, this here.
In front of Dr.
Yeah,
Backash? That's a heart, the model of the heart. And I think it's sometimes helpful if you could show the people what a heart attack is on that model of the heart.
Yeah, this is a representation of the heart. And on the surface of the heart are arteries and veins. And these arteries and veins actually give blood supply to the heart muscle. So on this model, the red is the arteries and the blue is the veins. In real life, it doesn't look so obvious, but these arteries here go into the heart muscle and bring oxygen and nutrients to the heart muscle so that your heart can contract. What a heart attack is that these small vessels, and you'll notice some of the vessels aren't any bigger than the filling of a lead pencil. If these vessels get clogged, wherever this blood vessel was supposed to go doesn't get any, this part of the muscle of the heart doesn't get any blood supply, and it dies. So if that happens, normally, most people would get some symptoms. They'd usually get chest pain. Women might get shortness of breath. Or you may have a feeling of indigestion or jaw pain or neck pain. And you have to get that taken care of right away, because if this blockage stays there, you lose a piece of muscle, and that does not grow back. So if you lose more than 40% of your left ventricle, you die. So, and there's no choice. So the vessels can be, this is a representation of what can happen to the vessels. And you'll see here, the vessel is wide open, and when there's a lot of plaque, if you eat a lot of cheesecake and cheese and fatty foods, it can get clogged. And you can see the opening is so narrow, there's no more room for blood to go through. So human beings are built with so much functional reserve that you won't get a symptom until it's 70% narrow. So by the time you get symptoms, it's time to run. You're in trouble. And that's why we take it so seriously, because the next step is death. So it starts off open, and then it slowly, you form plaque by eating fatty foods and not exercising and gaining weight, and even excesses of sugar because sugar gets metabolized into fat, and the fat clogs the arteries, and that's why this hullabaloo about New Yorkers' health and watching the sugar intake, because sugar causes heart disease as well and liver disease. So basically, that's why we treat it. So this is a very large representation of a blood vessel on the surface of the heart.
Thank you very much.
Right.
And I see we're running down into the last few minutes of the show, so we're going to do a rapid fire. We're going to take the questions and answer them quickly.
Okay, quickly, here you go. So what's your name? Where are you from?
Hi, I'm Teresa Hegel from Brooklyn, and I wanted to ask about the flu vaccine. There's so many pros and cons. Many people feel I do not want to take it because I end up getting sick immediately after. So what is the answer for these people who have second thoughts about it?
What do you think about the flu vaccine?
The recommendation is for everybody over 65 to have a flu vaccination. Flu vaccines are made according to recommendations of the CDC, which is our government-controlled agency who tells these drug companies what viruses to put in the vaccine every year. And the vaccines are administered pretty inexpensively to patients. They're about 50% effective. So the danger of not getting them, if there is a pandemic like there was in 1918 and people aren't vaccinated, is that there could be a very high, death rate. I mean, it's very safe. Very few people have side effects related to it. So the recommendation and the standard of care is to give flu shots, especially in patients over the age of 65.
Thank you. Kirsten?
Okay, here's the next question. Name and where you're from.
Hi, I'm Marel Saikali. I'm from Brooklyn, New York. I would like to ask the dentist a question, please. How long does the root canal needs to go untreated before you need to get an implant? I mean, is there a certain time that the root canal should, stay untreated before they tell you, oh, you need an implant?
It really doesn't have to do with the root canal. It has to do with, is the tooth restorable or not? So if you let it go too long and there's too much decay, then the tooth can't be restored properly. You need a certain amount of solid tooth structure to make a crown, to put the crown on the tooth after the root canal. So I can do root canal on almost anything, but if it can't be restored, then there's no point in doing the root canal. So again, it's about the remaining tooth structure. If there's not enough, then it needs an implant.
Thank you, Kirsten.
All right, so we have another question right here.
Yeah. Richard Nasser from Astoria. I have a friend who got shot, mugged, and he lived by himself. He has an attendant. I go to him quite often and take him by car for a spin. Now this guy happened to him that he can't control his bowel movement and he can have an accident anytime. So what can I tell him to do medically to prevent this kind of accident?
Great, thank you.
So what kind of disease did he have? He had a stroke? A shot. He was shot.
Yeah, he got shot.
Yeah, if he was shot in the brain. So there's urinary incontinence and then there's bowel incontinence. He has both. The bowel incontinence. Yeah, that's a very difficult problem. It could be due to cognitive issues in his case. Cognition is your ability to be aware of your own nervous system. He may have lost that ability. From the nerves that govern that could have been severed in his brain. So even though he gets the signals from his intestines that he has to go to the bowel, he can't enact mobility and to take care of it. So it's a very difficult problem to take care of. I mean, other than the obvious and wearing diapers. So it's a very difficult problem.
Thank you. Yeah, did Barbara?
No, I was just going to say, really, there's not a whole lot he can do about it other than wearing a diaper so that he's not embarrassed, but there's not a lot to stop it from happening.
Kirsten?
Yeah, we have a question right here. What's your name? Where are you from?
I'm Raimonda Kabaz. I'm from Lebanon. I have a question for the teeth doctor. What is the side effect of keeping or leaving the wisdom teeth when it's time to remove them?
Well, there's all different reasons when it's time to remove them, but one could be, again, decay, and it's not restorable. Why do we sometimes take out wisdom teeth and sometimes we don't? Most of the time when wisdom teeth come in, or they partially come in because there's not enough space in the mandible or the maxilla, the jawbones. But if they do have the space and they are in function, in occlusion, so they bite on each other and they are functioning, then you would try to save them. So there's no, hard and fast rule, you take out wisdom teeth or you don't take out wisdom teeth. It's like any other tooth. You take it out if it's causing a problem and it can't be corrected properly.
Thank you. I have to ask a question now, too, because we have another one for a shirt. And out of all the international travelers to the United States, what's the country that had the most number of travelers coming to New York? So, in other words, if I try, which country do the most tourists come from to New York? And I have to ask one question from Lebanon, from the Lebanon person. What's the best restaurant? I always like to know restaurants. What's the best restaurant in Lebanon? If you had to go to one meal in Lebanon, where would you go?
There is La Sage, is Lebanese restaurant. It is on.
In Lebanon? No, in Lebanon.
In Lebanon?
Yes.
Well, they say there is a restaurant. It's really very terrific restaurant, and it was recommended. And the name is Futu Mutu. Means you go in and you die.
Thank you. All right, we thank you for that. Yes, Kirsten, I see they're getting restless in the front here when you get.
Are they? We have Father has a question back here.
Okay.
Father Antoine, here you go.
I have a question. I have a pain on my back, but I thought maybe it's because I sit down all the time almost. But recently, I feel a pressure in the front too. So what could be the reasons? To whom doctor should I address my issue to?
Okay, who would you, if the father came in and you're in the emergency room, who would you send him to?
Well, first it would depend on our exam to decide if we think that this is really coming from the back itself. And if it is the back, it would be, there are orthopedists, an orthopedic doctor, those are the bone doctors that specialize in the spine. We have a spine center at Methodist where I would refer you after some testing to make sure that it really was your back we were worried about. And sometimes back pain does come around to the front. Other things, though, that are in your back are your kidneys, and so we worry about them. So we would do some simple tests about that as well.
Thank you. Kirsten.
All right, we have Jamal back here with a question. Jamal, where are you from?
Yeah, I'm from Brooklyn. My question to you, taking some blood pressure medicine like diuretic will lead to lose some mineral in our body. And that could lead to osteoporosis, or like when you lose the calcium and the magnesium. And I was listening 2 days ago to the radio, New York station. They were talking about this, making a commercial for a medicine to buy from the counter. So my question to you, I'm taking a diuretic since 10 years almost. How can I decide if I need to take a supplement medicine from the counter, like calcium or magnesium or whatever? Sometimes we feel tired, we don't know what the reason. We think because maybe I am getting old, but this is not the reason. Maybe because I have lack of mineral. So how can I make a decision? Should I go to the doctor or go to the counter?
Question, just to rephrase, the question is taking a diuretic. What does he need to do to ensure that the rest of his body stays healthy?
You should have regular blood tests done just to make sure your electrolytes are okay. But most of the diuretics that are used for hypertension, in fact, any diuretic actually does what you say. It does actually deplete your bones of calcium. Thiazide diuretics, which are most commonly prescribed, like hydrochlorothiazide, or even Lasix, which is a much stronger diuretic, causes loss of calcium. So what you would do is, besides blood tests, is you can have the doctors draw a vitamin D level. You could also have what's called a bone density study to see what the density of your bone is. And they take samples of your non-dominant side, like if you're right-handed, your left wrist, your spine, and your left hip. And from that, they can actually determine if you have any density problems with your bone. But having said that, thiazide diuretics are the most commonly prescribed antihypertensive medications in the United States, and they're considered standard of care and very effective, and they actually multiply the effect of regular hypertensive medications. So unless there is something very bad that's going on with your electrolytes and with your bones, I would stay on it. But that can be measured. You could also actually see how much calcium you're excreting in your urine by taking chemical tests in your urine to actually see if you are losing it. So that can be measured as well.
Thank you. Does anybody have an idea what country these tourists are coming to New York from? What's the who? Japan is. Japan. No. China? No? No. Middle East? No. It's a country. It's a country. Lebanon? No. Canada's getting close. Very close. It speaks English. The English speak. London. Who said London? Is London the country or the city? But I like London. It is England. It's England is the answer. England.
That was you, wasn't
So
it?
enter-
I thought so.
Yeah. Thank you very much.
Perfect. Good
So
job.
the answer was England.
Here you go.
England sends the most number of tourists to New York each year.
Great, Doc. We have a very special question up in the front.
Oh, we can't miss out on
For
that.
you, what's your name and where are you from?
My name is Christian. And
You can speak up. There's only 2 million people watching.
okay. My name is Christian.
Where are you from?
Okay.
Do you have a question?
What's wrong with
It's okay. What's your question? Do you have a question?
Yeah. Sometimes when like I run a lot, like my like chest starts to hurt, like from like my solar plexus.
Okay,
Starts
so
to
when he
hurt.
writes
Like,
a lot, his
what do you think
stomach
is going on?
I mean, that's Dr. Gatton.
So when you run a lot, you start to feel like you get a tightness here? Is that what you're saying?
No, like my solar plexus starts to hurt a lot.
That's your body telling you to stop and rest for a minute. It takes some deep breaths. That you run out. What happens is we use oxygen in our muscles. And when you run too far or too hard, then you use up all that oxygen and your body says you need to rest a minute and let some oxygen get back in and take some slow, deep breaths. And that's usually why you start to get that pain, is your body saying, okay, it's time to take a break.
Christian, that was a beautiful question. Very well stated. Thank you. Excellent.
Here's a little something for all of you to share since you've been doing such a good job today, okay? Thanks, guys. Okay, I think we have a
I
question
can't believe
right
we're
here.
just about to the end of the show. This is the
know.
last question. You get
Oh, this is it?
Yes.
Okay. Here you go. So you can stand up. What's your name? Where are you from?
My name is Daniel. I'm from Brooklyn. My question is for Dr. Again, the ER attending. My last visit to the ER room, I guess the biggest complaint people get is the wait. You're sitting there waiting 12 hours, 15 hours, and with hospitals closing down in New York, what's your hospital doing to alleviate the crowding in there?
Yeah, actually, we've spent a lot of time in our hospital trying to alleviate crowding. The problem is exactly what you say. Hospitals are closing down, so there are fewer emergency rooms left to go to. And unlike a doctor's office where people schedule appointments, people don't schedule appointments for the emergency room, so you never know how many people are going to have an emergency at any given time. And that's why the waits are sometimes longer in the emergency room than a doctor's office, is it's just tough to predict how many people are going to get sick at any given time. And the way the emergency room works is it's not first come, get seen first. It's the sickest person gets seen first. The person having a stroke or a heart attack, they're going to be seen first of all, and everybody else, unfortunately, has to wait a
Barbara,
little bit.
I can't believe we've come to the end of this show. It was so really fantastic. I want to thank Father Antoine, of course, Dr. Bakash, Kirsten for all her help, but most of all, you out there, for coming in and being good sports and asking good questions. It really helps a lot. You watch this show, I think you're going to enjoy it.